Hello everyone, welcome to the second seminar for using ultrasound to evaluate the abdominal anatomy, in which we are going to talk about the great vessels and mainly the kidneys. First of all, we need to remember the technical information, exactly the same information we delivered in the last seminar. So remember the probe. Remember the probe, which is specifically designed for evaluating the abdomen, which is the curvilinear. This is the real name of this probe, this low frequency probe for evaluating deeper structures with not so good resolution. In this schematic view is kind of a reminder of what we are going to treat today. Both vessels, the great vessels in the abdomen, which is the abdominal aorta and the inferior vena cava, and the two kidneys and their relationships in the abdomen. So let's start from the great vessels. This is an actual abdominal cut of preparation of the abdomen, in which we need to remember the relationship and the landmarks we are going to use. As you know here, as you can see in the screen, both vessels, the aorta and the inferior vena cava, are slightly anterior to the spine, to the vertebral body. And this is exactly the landmark we're going to use to evaluate and to identify our two main vessels. First of all, we are going to do a transverse scan at the level of epigastrium, so proximal, the most proximal scan we can go. And this is the scheme, the schematic view of we are going to assess the vertebral body with a posterior shadowing, aorta in the left side of the screen, and inferior vena cava. In the most proximal cut or scan, we will evaluate something like this, like seagull wings or like a whale tail. So on top, the most superficial part looks familiar for us, and this is exactly the left liver lobe, and there are a lot of structures here indicated by arrows. Remember where the landmark and what the landmark is, our main landmark, the vertebral body. So anterior to vertebral body is the aorta and the inferior vena cava in the right side. So there's a tube coming out from the aorta, which is the celiac trunk, separated or bifurcated into two branches, the hepatic artery and the splenic artery. If we are going a little bit more inferior, same epigastrium but a little bit more inferior, we will move into this scheme: vertebral body, aorta, inferior vena cava, and different other structures. In real time, we are assessing as well the left liver lobe, and again different arrows pointing to different structures. First of all, you have to remember what the landmark is, the vertebral body exactly. So again, aorta and inferior vena cava. So there's another artery, another tube, another round structure, right, slightly anterior to the aorta, and is the superior mesenteric artery. And there's a structure between superior mesenteric artery, a tubular structure, a vessel-like structure between the aorta and superior mesenteric artery. And this is the left renal vein, exactly. On top of the screen, which means more anterior to superior mesenteric artery, we can find the splenic or portal vein. So the splenic vein becoming into the portal vein. If we go down, we will continue seeing the aorta and inferior vena cava till we reach this level, which is slightly in the hypogastrium. So vertebral body as always, and we are actually seeing the iliac's bifurcation. If we turn our probe 90 degrees and we move to a longitudinal scan into strictly sagittal midline, the scheme will be totally different. We will cut every single vertebral bodies joined as a spine, a big tube with different branches coming out from the tube. So real time. Again, left liver lobe and different arrows pointing to different structures. So the main one is the abdominal aorta in a longitudinal view. So the celiac triangle is the most proximal. Remember, from left to right, the image, we are looking at the head and feet. So it's head, feet, coronal and inferior disposure. So abdominal aorta, the more left is the more superior. So celiac trunk with a small branch pointing towards the patient's head, which is the left gastric artery. The second is the superior mesenteric artery, which is going parallel to the aorta, and the left gastric artery again. If we move to paramedian scan, to right paramedian, we're going to place our probe facing right in the same axis of the inferior vena cava. As we see here, we are looking again at the left liver lobe, the caudate lobe separated from the left liver lobe by the venous ligament, as we told previously, and this big structure, tubular, vessel-like structure, is the inferior vena cava, and the other is the portal vein. Moving to the urinary system, we are going to face our probe, we are going to position our probe into the lateral part of the trunk. We're going to a pure coronal scan, moving our probe to the mid-axillary line, medium maxillary line, at the level of the last ribs, with our probe marker pointing towards the patient's head. And we'll evaluate the right liver lobe, the right kidney, and the psoas muscle. If we move to the other part, remember that the left kidney is a little bit more superior and a little bit more posterior than the right kidney. So probably the place to put the probe is the posterior axillary line. To see this, an organ-like structure, which is a spleen, and the left kidney. All of these shadows are coming from the ribs, because the left kidney and the spleen, of course, and are a little bit more superior, so are actually in the thorax, are surrounded by ribs. So thanks for watching.